I really just wanted to take the opportunity to speak just very, very briefly about why we have chosen the topic of leadership for this conference. I think you all know that this is a very, very important time in nursing. It has taken a lot of nursing leadership to get us here. We often go back to our founder of modern nursing, Florence Nightingale, and we speak about her leadership and what she did in order to bring nursing into a different realm of education, a different realm of leadership, using statistics and evidence to make massive change in hospital-based care. We think about the leadership that it has taken from nurses to bring us into a full level of academic recognition. Also the leadership it has taken to have nursing be a full participant in discussion with regard to healthcare reform. And we've got leaders here from New Jersey, leaders here from outside of New Jersey, a great amount of expertise in this room that we will be engaging with over the course of the next 2 days with regard to education, to practice, and to policy.
We certainly are at a sea change in nursing. The Affordable Care Act offers us great challenge and great opportunity. And when we overlay that and look at the synergies that are offered within that opportunity and within the opportunity and mandate of the IOM report, which Sue Hassmiller will detail more tomorrow for us, we know that our opportunity to come together across education, practice, and policy is probably no greater in any time in nursing's history than it is now. And that's what we want to reflect on over the next 2 days with all of you. In addition, we're at a time of extraordinary uncertainty in the broader global environment because of the economic challenges. But in times of great uncertainty, as we look across the history of the nursing profession, nursing has really emerged as the driving force of the changes that create stability. And so within the instability, we're looking forward to nursing's opportunity to be the stabilizing force.
In the next 3 years, there is every possibility that in New Jersey we will see 375,000 new eligibles into the Medicaid program. We have no money and no infrastructure to support it. And most of these individuals will be young women and children. And we will have to find a way in which to offer them access to medical care. And the people who will be on the front line of providing that care and advocating for them are nurses. It's not going to be the doctor, because doctors increasingly are not seeing Medicaid patients. So that's just one example of where you're going to be asked to step up and demonstrate some leadership in shaping public policy. And I urge you to spend some real time thinking about what you feel passionate about, that you can talk to other people about with respect to your role in nursing and how you want to be a part of transforming our healthcare system so that nurses sit not on the fringe of it, but actually are the catalyst and the core component, one core component of what people look to when they think about their healthcare system.
It's increasing levels of responsibility is implicit in a career. I don't know about you, but when I was coming of age, the nurses I knew were in doctors' offices, and they did the same thing in one decade that they did in the next decade and in the next decade. They could give injections without it hurting. They were swift. They knew how to weigh you, but what they did didn't change. And so that's a job. You can be good at a job, but a career means that you are not doing in every decade the same thing. You keep evolving. And even if you stay and work for the same organization for 50 years, what you would do at any piece of time is going to look different. There is going to be increasing levels of responsibility you've assumed. And then finally, one of the characteristics of a career is that you incur the obligation to nurture subsequent generations and to shape the future. I mean, you have the obligation to nurture and mentor, even if you're a curmudgeon. a lot of the early literature in nursing sort of implied that mentoring was I see in you what I used to be, and then I sort of facilitate you, balderdash. It sort of made it into sort of a mystical, and like, I'd be nice to mentor you. That's not nice. I have an obligation to facilitate subsequent generations. We incur that as part of going into a career.
I know I'm speaking to a group of future educators, and I think that one thing that I just want to make sure that you realize is that when you're teaching your nursing students that research and quality improvement and evidence-based practice does not only have to occur within the university settings. And we've been very successful. We have what's called research scholars, quality scholars, evidence-based practice scholars, leader scholars. There's a number of different ways that you can be a scholar, and you're economically incentivized to be able to do these things as well. And to also always look for partnerships within the healthcare system, the practice setting, for either your own research or activities, or to be able to mentor other students into those programs as well.
What made this report, I would say, stand out and a value for you and your colleagues and everyone who will be asked to do something with the recommendations, is that there was an expert of non-nurses who came to the same conclusions as nurses leaders. I mean, if you look at the recommendations, you look at them and you're shaking your head, well, yes, of course, and you know, some of them you've heard before, right? Well, sometimes recommendations have to be made 2 and 3 times because nobody ever did anything with them, and you have to keep hitting people over the head with them again and again. So some of them you'll say, I've heard that before, but yeah, right. Some of them are unique and bold, like some of the scope of practice ones, but we all agree with it. But the leadership of the committee, comprised of 18 high-level leaders, only 5 of whom were nurses. We're talking, we had an attorney, a couple of physicians, a social worker, a dentist, some high-level policymakers from former administrations. They all came to the same conclusions because they had to, in order to make the recommendation, study the text, study the evidence, and make those recommendations. And that's what makes this credible in this country at this time. The IOM gave its stamp of approval